Yes, sir. Good afternoon to one and all present here. Welcome to the first session of Amity 2022 Biomaterials and Technology session. Biomaterial encompasses substances intended to interface with the biological system to evaluate, treat, augment the functioning of living system. We are honored to have with us Dr. Ashwini Chauhan from Tripura University as our session chair for this biomaterial and technology track. Dr. Ashwini Chauhan, currently working in Tripura University, specializes in the field of microbial physiology and infection biology and its detection. He has been associated as a researcher in prestigious institutes like University of Rochester, Institut Pasteur, BioAster Lyon. He has funded projects from UGC, DST, ICMR, and SERP. He has more than 1,750 citations with a cumulative impact factor more than 170. Without wasting any further time, I would request Dr. Ashwini Chauhan to take over the session and start with our poster presentations. Thank you, sir, and we welcome you to our dais.
Thank you so much, Dr. Datta, for the wonderful introduction. And you have already mentioned the importance of this session. And without taking more time, I would request the participants to start with their poster presentation so that we can finish it on time. And Dr. Datta, if you could just tell what is the time limit so that we can stick to the time very strictly. And
yes,
so that we have enough room for the question answer session.
Sure, sir. I would request the participants to stick to a 10 minutes time frame for the presentation with a 5 minutes session for question answers. Any extra time would add to your deduction of marks. So please stick to your time limit. Thank you. So the first participant is
Mr. Khalid Mohammed Ismail. So working on Zika virus. So
Mr. Ismail, may I request you to share your unmute yourself, Ismail. Still not audible.
I hope I'm audible now.
Yes.
Yes,
yeah,
you're
sure.
audible now.
So I'll better start with the presentation. Nice to meet you, Dr. Ashwini Chauhan, after a long time.
Let me start. Hello.
Yeah.
So you are in Russia right now?
Yeah, I'm in Moscow.
Okay.
So I'm going to present today about my project with when I'm during my bachelor studies in NIIT University under the mentor of Dr. Narayan Kumar, under the project of computer-aided analysis of phytochemicals and potential Zika virus inhibitors based on molecular docking and its admin property studies. So that is the outline of our project, and I'm going to talk about what are the implications I've gone through this particular project. So first of all, I'm going to talk about the background objectives. Zika virus basically belongs to the family of a flavidae, which is very highly relatable with viruses like a West Nile virus and dengue virus, which is very much familiar in India, and which can be spread through mosquitoes like Aedes aegypti, which will later lead to the processes. It can be lethal in certain cases. So as we know, as I'm from south of India, it's very familiar with the condition of a dengue in monsoon seasons. So in that such scenarios, we don't have efficient drug therapeutics in that dengue virus, and which is having a similar scenario in Pacific Islands and Brazil and lots of South American tropical countries. So which will later have a high amount of mortality, and one of the main disastrous impact because of Zika virus is because it's infection to prenatal infection, and it can later lead to improper growth of a baby's brain. So that's a very important hazardous area of the Zika virus. And still, we don't have any efficient drugs available to treat this particular disease. And some are in trials, but we don't have anything on the market. So one of the things which we have gone through in this particular project is to use the drugs which is already there, which is based on phytochemicals like papaya leaf extract and lots of other traditional medicines like based on Ayurveda, um, and use it for treating Zika virus. So in this particular project, I'm going to talk about how we model this particular drugs, and we can go for the molecular docking and how efficient was this. So later, I'm going to talk about what is Zika virus. As I said before, Zika virus is basically belong to Flaviviridae family, and which is even after it was found like nearly 70 years before 1947, we don't have any kind of efficient drugs or treatment methodologies to for Zika virus, and which lead to lots of life-threatening situations in Brazil and Pacific Islands, and it leads to prenatal issues like microencephalitis in infants. So that's a main problematic situation associated with this particular issue. And for this particular research, the main idea is to talk about the molecular docking. So we have to go a little bit into the process of proteins. Like there is a two different capsid proteins and two membrane proteins, and like envelope protein and 7 non-structural proteins. For this particular project, I have studied non-structural proteins, which is very much involved in the process of replication of during its process of incubation in human cells. So a target protein is basically non-structural protein NS2B, NS3. So later, when we go through the process, I'll explain it better. So later, I'm going to talk about the methodology. So first of all, as I said before, dengue and ZigBee are both related based on the same family, and we have tried to explore its relativity between lots of available viral particles with viral treatment options to have a homology modeling for a doctoral process. And but dengue and ZigBee have a higher relativity, and later we have go through reverse pharmacology. As I said before, we are not designing any kind of drug, synthetic drugs, particularly for this particular disease, but we are already using the drugs that are present in the market to treat this particular virus. So that is the idea behind it. And later we are going through phytochemical analysis. There's a 7 different phytochemicals associated with this particular papaya leaf extract. And later we are going to talk about what is the target protein and molecular docking and ADME profile. So let's begin with the results. As I said, there's a very wide range of infectious disease associated with this particular family, and we have to try it with a multiple sequence analysis, and came to the conclusion of dengue and ZigBee having high relativity. And also for this particular project, we focusing only on the phytochemicals for the treatment of this particular virus. So it's better to go in the way of the dengue because it is very much studied in India, and it is already in clinics for people are treated with this particular phytochemicals. So it's better, and it will be much more efficient in the later commercialization situations. So as you can see, there's about 60% relativity between ZigBee and dengue, and when we go to the homology, relativity between our protein, like NS2B and NS3, it's nearly 90% relative, and it's having a similar binding pockets, which is very helpful to study its reactivity with our phytochemicals. So later, as I said, here we are using phytochemicals, and for this particular study, there's like, even though a lot of other phytochemicals are currently used to treat dengue, I have focused my research on Carica papaya, which is a papaya leaf extract, because it's very much studied and very much well used India and in international clinics. So it can be treated for fever, pyrexia, diabetes, gonorrhea, syphilis, and a lot of inflammation and as a wounds. So it much more viable and it's very much studied and it is used in clinical treatment purposes. So it is a better option to for this particular study. So I'm going to talk about what are the phytochemicals involved in this particular study. Those are
Ismail,
yeah, sure.
you have just 3 minutes, so I would prefer you hurry it up, okay?
Absolutely, totally just like that. So first of all, there's a question: chlorogenic acid and coumarin caffeic acid, camp and coumaric acid, and protoacetic acid is involved in this particular study, and which is modeled through Kim's sketch, and then later helped to associate it, helps in the process of a docking. And the target protein prediction is based on the literature study which we have gone through, based on the dengue, which have already tried this particular docking process with dengue, the protein of NS2B and NS3, which protein is similar, very similar in also NS2B. So we use that particular protein for our study. Later, molecular docking, this is just a procedure, and this is basically talking about the software which we have used. It's AutoDock for docking and SIGBIN as a terminal, and OpenBabel for successful 5-format studies and energy minimization in SPT. So, which is very helpful in the process of, which is very, it's a ready-made software which is very convenient for our study. So we have used it, nothing much more specific about it. So later, about the ADME profiling, we have to use the softwares like ADME and to talk about based on the Lipinski rule to study the properties of our phytochemicals which we are using right here, and then later, as I said before, which is already in the treatment, which is for patients, it's not having much of a toxicity towards, and it is a phytochemical, so it is much more available option than any other drug is available. And later, we're talking about discussion. In this particular situation is a highly effective. In this particular study, we have visualized our bond between chlorogenic acid and quercetin with our target protein. So the main discussion about this whole situation is as the countries like the Pacific Islands and Brazil, which is Brazil is almost a very developing country, but Pacific Islands is a underdeveloped country, so it is not having efficient funds to produce any kind of efficient drugs for their clinics. And every year there's a lot of thousands of children are basically infected with this particular disease. So treating with the phytochemicals is a much more viable option for them and much more cheaper for the use of them. So that is the main idea of this whole research. And then we have modeled this drug to study later. This is the very first step background to synthetically design these drugs for much more purity, if we are considering about the purity of this whole drug. So I guess that is the whole presentation. Thank you for your time. Thank you for the attention. If there are any questions, I'm open for it.
Thank you, Ismail. Thank you for your presentation. Good that I could finally hear you. I wasn't there during your project time at NIIT. I left that place. Is there any question from any of the participants? So if there are questions from any of the participants, otherwise I have a few questions to ask.
Sure, absolutely.
Okay, so Ismail, you said that Zika, you worked on Zika and then you compared it with dengue.
Yeah, absolutely.
And dengue is much more relevant to India as compared to Zika.
Yeah.
And Zika is more localized to, Central American countries. So why would we even worry about something which we don't care? Because in 2021, there were just 237 cases that were reported in India.
Yeah.
And the rate of mortality and morbidity is very less when it comes to Zika as compared to dengue. So
Sure.
why didn't you work with dengue?
Yeah, the main idea of this whole research is diversification. As you can say, dengue is having high danger towards Indian population. As I'm from the south of India, we every year we face with the issue of monsoon season. We face the dengue, but the problem is we have the drug, and which this particular drug is efficient towards dengue, and which is based on Ayurvedic medicine. They are using it for years, and it's having a positive result. So the idea is to use that particular result with a highly related to viruses like Zigbee or a West Nile virus, which is not having any efficient drug, and then we can diversify and commodity make it a commodity reputation of this whole process. So that is the
Okay.
idea.
Okay. Then another thing is like you did most of your studies were based on molecular docking.
Yeah.
So what are the limitations of molecular docking?
Yeah, sure. Actually, I'm currently working in molecular dynamics study. So in my master's thesis, I'm writing the softwares for molecular dynamics. The problem in protein and the material science of molecular dynamics, because we can design software for metallic objects, because the lattice structure is permanent and we don't have any dynamic reactions, and the environment is very simple. Because if I talk about laser ablation process of metallic for nanoparticle generation, it's very easy comparatively to the 3D structure of a protein design. So, and the expensive, I mean, in a computationally expensive process to study protein. Like in this particular study, we have used only single processor, and it's a very simplistic softwares to work on, and it is not having higher efficiencies to talk about the bonds between atoms and the molecular structure of macromolecules. So we are, this is basically science setback.
I'll just interrupt because that's a very long answer. I'm not expecting that long answer.
Yeah, sure.
So another thing that I would like to say, since you are working in bioinformatics, and you are doing simulation studies, so how much idea do you have that how much these data are translatable? I will not even say to the in vivo studies. I will just talk about how much translatable they are to the in vitro studies.
Sure. So the
short answer.
It is highly negligible amount, because we are having lots of data, and we need to work on much more sophisticated instruments. So that would be my answer. Right now, we are in a setback.
Okay. Thank you so much, Ismail. I think I'm kind of done with the question and answer session here.
Thank you.
And maybe we can go to the next, presenter. It's Nidhi Vashisht. I don't know if she is there. And so, Dr. Datta, if you could just like make sure if Ms. Nidhi Vashisht
she is there. She is there.
She's there. She's there.
Yes. Nidhi, can you your slides and make yourself audible?
A minute, please. Am I audible to you?
Yes, yes. You're both audible and visible.
Firstly, a sunny and happy good afternoon to one and all present here. I, Nidhi Vashisht, from research scholar from Jayoti Vidyapeeth Women's University, Jaipur, Rajasthan. Welcome you all to the International Conference on Advanced Materials and Innovative Technology held by MIT 2022. So now I start. Our topic is nanotization and characterization of iron-based Ayurvedic medicine, that is Landur Bhasma. So our present study embraces of introduction, experimental techniques, result, and the conclusion. So the introduction is metallic preparation called bhasm, that is fine powder obtained through calculation. It is a unique method in Ayurvedic system of medicine in which metallic state is transformed into suitable compound form with a therapeutic activity. The present study examined the utility of Mandoor Bhasma along with Purnav extract of treatment of anemia. The iron that remained preserved under the earth crust for 80 to 100 years, it starts rusting and it's chemically known as ferric oxide. This iron is extremely beneficial when it's purified and in crust form. Its formulation in Mandoor Bhasma in Ayurvedic science. Mandoor comes under the group of iron-based metals having huge therapeutic value. Mandoor Bhasma is a formulation that has been therapeutic values. It is not only used for the treatment of anemia, it is also used for jaundice, poor digestion, edema, skin disease, and etc. This paper aims at providing specific manufacturing procedure, GMP, that is good manufacture practices for the manufacture of nanoparticles of iron oxide ash, and also attempts to study the effect of different steps and process on Mandoor ash formation. The presence of Fe3O4, that is ferric oxide magnetic nanoparticles, and observed a layer of plant extract is confirmed by the X-ray diffraction pattern, scanning electron microscopy, and Fourier transform eye infrared spectra, that is FEIR. The present experimental study justifies the use of Mandoor Bhasma in the Ayurvedic system of medicine as a nanoparticle drug. So the next is experimental characterization techniques. The first one is preparation and nanotization of Mandoor Bhasma. Second is X-ray diffraction, that is structural characterization. Third is scanning electron microscopy, that is morphological characterization. And fourth is Fourier transformation infrared. So this one is preparation and nanotization of Mandoor Bhasma. Firstly, we take raw materials, heat the iron oxide mixture, that is Mandoor pieces, up to 100 degrees Celsius. Then we dipped it in cow urine, that is organic solvent, for detoxification and size reduction. Then repeat detoxification and the size reduction for the 7th time. Again, we grade and heat up to 600 degrees Celsius. Mandoor powder titrate with trifluquat and repeat all the process, grinding and heat up to 5 times. We repeat this process for 5 times. Purnava Gajput heat temperature is maximum 800. Process repeated for 30 times. It is like a furnace. Gajput is like a furnace whose temperature is taken up to 800 maximum temperature. Finally, Mandoor nanoparticles prepare. We see in the image final nanoparticles. Mandoor nanoparticles are like this, and this is the Mandoor preparation with plant extract. This one is. Okay, so the next one is structural characterization. It is a graph between intensity and 2 theta. It is a X-ray diffraction pattern of Mandoor Bhasma as nanocrystalline material with decreased particle size. We see there is a peak, which is so maximum intensity with broad. We see the maximum intensity. This peak show maximum intensity, and that is 311. As we observe, diffraction pattern of Mandoor Bhasma was also matched with JCPDS data, and the result of summarized in table 1, which is given below in the next slide. The observed X-ray reflex could be assigned the 111. Actually, we consider the crystalline in the planes X, plane X, plane Y, and plane Z. Second is 220. The most prominent peak is 311. We show that the nanoparticle in the cubic form. So next is 400, 422, 511, and the 440 planes of the cubic spinal phase of Fe3O4 ferric oxide. However, few relative weak peaks we see some weak peaks also there, observed at different 2 theta in case of sample a grown in the absence of any surfactant corresponded to the alpha Fe2O3. We apply their Bragg's law. Now it is a summary of X-ray diffraction data. The sample of nanomandur bhasma Purnava extract particle size is approx 185 plus minus 5 nanometers. So we consider 2 degree values of 2 degree, the value of D. D is the spacing between the planes. Here is intensity. From the above graph, we consider all this table. Minilar plane components and the phase. As we seen, Fe3O4 is a cubic form. Alpha Fe2O3 is a rhombohedral form. And there is some remaining polymers, which is extract when we extract plants in Mandur Bhasm, which is remain in that form. Now to move to the next is morphological and chemical characterization. In the presence of a plant extract, Mandur Bhasm formation, the particle size is very small by SCM, that is scanning electron microscopy, as we can see in here. These are the very small particles. The surface energy of surface passivated Mandur mixed iron oxide nanocrystal would be dominating the shape of the crystal, and therefore the spherical crystallites are observed. FTIR, that is a Fourier transform infrared analyzed result shows the major peaks in all 3 samples at 1525.474 centimeter per centimeter, 2332.8 per centimeter, and 3738.18 centimeter per centimeter with different intensities. The next one is our conclusion. So conclusion is we have studied the nanotization and nanometric analysis synthesis of iron-based Mandur Bhasm nanoparticles using in the aqueous extract of Purnava and Gunja, collectively called biocompatible herbo mineral drug, and characterized them using various techniques. All the analysis of scanning electron microscopy and X-ray diffraction analysis confirmed the formation of iron oxide nanoparticles. The SAM, that is scanning electron microscopy analysis, shows that enclosed packed nanocrystal of microcompatible Mandur nanocrystals, average cluster size around 560 nanometers. The self-organized Bhasma nanoparticles thin film gave rise to another interesting feature with smooth surface cluster, and the average smallest cluster size was predicted around 200 nanometer. The XRD analyzed further confirmed the lowest particle size of nanoparticles is around 185 nanometer. FTIR result shows the presence of organic capping and on nanoparticle surface as capping agent. So these are our references. Thank you so much.
Thank you, Nidhi, for the presentation. So I would just like to open the. So you were very much on time. That is the best thing. Like my timer went off after you finished. So that's really good. So so are you doing your PhD or PhD scholar?
No, I'm in bachelor's only. Right now, I'm in bachelor's.
So you are doing your bachelor's of technology or what? BSc in?
BSc in physics.
Okay, so you're doing BSc in physics. Which year? Sorry, this is just for.
I'm in last year.
You're in final year. Okay, pretty impressive. The way you presented. I hope you can. I have some questions. Looks like nobody has. So you used cow urine.
Yes,
I know you were not supposed to present, or I don't know, you were on the third of the list. Anushka was supposed to present probably, and I hope you're prepared for it. So you have used cow urine for detoxification and size reduction of nanoparticles.
Yes, sir.
why do you think the cow urine can detoxify and reduce the size?
Sir, actually, it is a reference from our Ayurvedic medicines, Ayurvedic books of medicines, that cow urine is very good for detoxification.
Detoxification. What do you mean by detoxification here?
Uh, Detoxification is like to detox, to purify or detox all the
Okay. So when you say Mandoor Bhasm, what I understood it, Mandoor Bhasm is like a iron compound,
yes.
right? I'm not very good at Ayurvedic formulations. I'm just trying to understand. Okay. Then you also mentioned about using plant extract. You did not mention which plant extract.
Sir, it's a Purnava plant extract.
What is Purnava?
Purnava is a kind of a tree. We can say.
Yes, of course. It must be some kind of a herb or something. I understand. But is there any colloquial name it has, or like is it characterized plant? And if it is used in Ayurvedic herbs, I'm assuming that it is used in Ayurvedic formulation. That's why you are using it as a reducing agent, probably, because that is one of the.
It is used for the reducing the size of the Mandoor Bhasma. It is extract for the reducing the size of the Mandoor Bhasma.
Why do you think it will help in reducing the size? Cow urine, you are saying it will reduce the size. Now you're saying, okay, it's echoing a lot. So, okay. So cow urine, you are saying that is going to reduce the size. Now you are saying Punarva is going to reduce the size. So what, have you done any controls without cow urine and without Punarva? Because your size are pretty big. What you are showing in SEM is very small compared to, because we also work on nanoparticles and we have nanoparticle size between 18 nanometer, like 5 to 18, and they are pretty distinct. Your doesn't, when I look at the images, it more looks like a bulk powder. I don't see crystals there. So how do you control that?
So the cow urine is used for the detoxification, and the Purnama plant extract is used for the reducing the size of the Mandoor Bhasma, that is ferric oxide.
What I noticed, the plant extracts mostly people use for capping, so that your aggregation is prevented. Okay, great. Thank you, and all the best.
Thank
a long way to go. Keep working hard. Thank you.
Thank you so much.
Yeah.
Yeah, good afternoon. Can we have Pankaj Soni as the next presenter?
Hello.
Yeah, Pankaj.
Am I audible?
Yeah, you're audible. You can share your screen and start the presentation.
Okay, sir.
Pankaj, please start.
Sir, is it visible, sir?
Visible, you can start your slideshow. Full screen, please.
Okay.
Yeah, it's okay now.
Good afternoon. I'm Pankaj Soni. Currently, I'm pursuing MSc in Applied Physics from MIT University, Jaipur, Rajasthan. I'm going to present on photocatalytic and antimicrobial activity of AgW34 cell. Here is outlines. which we are discussing. First is introduction, second is synthesis of core cell, and third is characterization techniques. Next is result in discussion, and next is conclusion and the future scope. So first is introduction. So introduction is what is nanoparticles, Ag nanoparticles, W3 nanoparticles, and core cells. So first, what is nanoparticles? A nanoparticle is a small particle that range between 1 to 100 nanometer size and undetectable by the human eyes. And nanoparticles can exhibit a significant direct physical and chemical properties to their longer material compounds. So Ag nanoparticles, what is Ag nanoparticle? Silver nanoparticles are nanoparticles of silver of between 1 nanometer to 100 nanometer in size, while frequently described as a being silver. Some are composed of a large percentage of silver oxide due to bulk silver atoms, and some WO3, and same the WO3, its size also in the range between 1 nanometer to 100 nanometer, and WO3 nanoparticles are available in the form of nanofluids. So what is the core cell? Core cell nanoparticles are a type of biphasic materials which have an inner core structure and an outer shell made of different components. So here Ag is a inner core and WO3 is a outer shell. So now proceed to the next slide. Here is synthesis of AgWO3 core cell. First of all, we synthesize the silver nanoparticle in it. First we take a distilled water in a beaker and we put AgNO3, and after putting AgNO3 we after putting AgNO3 we put on it at a magnetic stirrer with the temperature of 90 to 98 degrees centigrade, and we wait for the reaching a boiling point, and when the solution will reach at the boiling point, we start putting the trisodium citrate dropwise, and after putting trisodium citrate dropwise we found Ag nanoparticles which will come in the yellow, and after found Ag nanoparticle leave for settle at the room temperature, and after settle stored in the ice bath. After Ag nanoparticle synthesis, we start WO3 synthesis. Same, we took a distilled water in a beaker and we put sodium tungsten dihydrate and stirring for some time, and after some time we put hydrochloric acid dropwise per drop, 1 drop per second, and after some time after putting hydrochloric acid, so after some time we found light yellow color of WO3 nanoparticles, and when light yellow color we found, we put the Ag nanoparticles in the solution, and after some time put Ag nanoparticle, and after 3 to 5 hour stirring we found the AgWO3 core cell in liquid form. After centrifuge on 700 rpm to wash and dry, we found after drying and grind AgWO3 core cell in powder form. So after synthesis, we will discuss about characterization techniques. What is characterization techniques we use? First is UV visible spectroscopy, second photocatalytic activity, and third is antimicrobial activity. So We will discuss about result and discussions of characterization. First is optical property, where optical property. First is UV visible spectroscopy. Here is two graph of UV visible spectroscopy. First is visible spectroscopy of AgW3 core cell. So here we found a peak on wavelength of 324 nanometer, which is fall under UVA rays. And next slide, next figure, we found band gap. We found band gap from the top plot, and we get band gap 3.6 electron volt. And next is photocatalytic activity. So photocatalytic degradation of aqueous methylene blue solution employing the effect of different Ag loadings. Here we can see first here some graphs. One is WO3, simple WO3 graph, and second is without catalyst, and next is 0.1% Ag in the WO3, and next 0.5% Ag in the WO3, and next 1% Ag in the WO3. So in the presence of 0.1 mole NaBH4 under visible light radiation, we found the graphs. Here the photocatalyst degradation reaction rate consists using here 0.4 0.1 AgWO3.
Pankaj, I would request you to do it faster because only 2.5 minutes left. Okay.
Okay, sir. So catalyst with various loading concentration has higher photocatalyst activity, and with 1% AgWO3 being the highest activity among the after 60 minutes, we found reaction rate constant using 0.1% AgWO3, 0.01366 per minute, and for 0.5% AgWO3 we found 0.0141 per minute, and for 1% AgWO3 we found 0.01637 per minute. And after that we discuss about the antibacterial activity result. So antibacterial activity of Ag and WO3 was tested against two bacteria. First is S. aureus and second is E. coli. So we found degradation of S. aureus bacteria having 32.2 mm diameter and 11 mm for Ag. Inhabited Ag and WO3 nanoparticles, and degradation of E. coli bacteria having 0 mm diameter for both nanoparticles. So after that we reach on conclusion. So nanocrystalline silver supported on tungsten oxide WO3 nanoparticles were successfully synthesized by the chemical precipitation method. The core cell AgWO3 nanoparticles have been prepared successfully by co-precipitation method, and from UV visible spectroscopy absorption as has been estimated in UVA rays range, and semiconductor nature of AgWO3 has been observed. 1% AgWO3 photocatalysts demonstrate significant methylene blue degradation, visible light compatible with the degradation. Next, degradation of S. aureus bacteria having 13.2 millimeter and 11 millimeter as inhibited by Ag and WO3 nanoparticles. So next, future scope. we can use AgWO3 core cell as a superior sensor in the future, as well as in energy storage device making we can use, and the enhancement of the electromechanical properties and sensor based application. And here is some references. First is SK Das E. Marshalli, which bio-inspired metal nanoparticle synthesis properties and application in nanomaterial. M. Rahman edition.
Pankaj, please wind up. Your time is up. And so I would like you to wind up now so that we can go to the question answer session.
Okay, sir. Thank you.
Yeah. So I request if any of the participants have questions. Okay, Pankaj, I have few questions. So your work is probably you're in masters and your work is assigned by your PI.
Yes, sir.
So it's a good work, definitely, yes. So just very basic questions. In your future scope, you said that you can make sensors and all. Why did you even check the antibacterial activity? Why did you check? Why did you check the killing?
Actually, sir, we are trying to know our nanoparticles is toxic or not, and which type of bacteria is react on that.
You want to see the toxicity on bacteria. Bacteria are infectious. The bacteria that you have, I don't know, you are a physics student. If you know, Staphylococcus aureus is a pathogenic bacteria. So if you're killing it, it's good, right? Though although your experiment, I'm not really happy with the way it has been done. Nanoparticles diffusion in agros. Anyways, so you discussed about the band gap. Can you explain to me a little bit about band gap and how this is important for nanoparticles? What does it do? Why do you need band gap?
Sir, band gap we need for the find conductivity of material.
So how it is? What do you think if a nanoparticle has a? Let's assume there are two nanoparticles. You are using silver plus. You're making a composite kind for silver and tungsten, right? Tritungsten oxide.
Yes.
So if you have tungsten oxide and you have this core, and if one has a better band gap, more band gap, what do you think? Which one will have a better photocatalysis activity?
Sir,
the one with a more band gap or the one with a small band gap?
Yes, sir. Ag is more band gap, sir, but tungsten oxide is small band gap.
Small band gap. Okay. You know, tungsten, tritungsten oxide is reported to have a large band gap. There are reports available. Okay. Why did you use HCl? In your procedure, you explained why did you use HCl? What is the purpose?
Actually, sir, sodium tungsten dihydrate. Sorry. Sir.
Pankaj, do you know or you don't know?
No, sir, I don't know. Sorry.
Okay, that's fine. So that's fine. Thank you, Pankaj. Thank you.
Thank you, sir.
Yeah. Can we have the next presenter, Sivat Pongbiabun? Are you there, Sivat?
Yes, sir.
So kindly share your screen and start the presentation. Yes, Sivat, your screen is visible. You can start the presentation. Thank you.
Okay, sir. Yeah, okay, sir. Okay, so good morning, everyone. Good afternoon, everyone. I'm Sivat from Deja Moody School. So to give you a little bit of background information, diabetes is a chronic disease that is caused by abnormal glucose level in the bloodstream. So from the picture from the left, this is associated with many health issues like eye problems, nerve damage, increased risk of dementia, and bone diseases. So this makes the disease among the top 10 death causes. I think this is very important for India because India is one of the top 3 countries that has the most diabetic patient. So another problem I want to, the finding of this paper will help me address is oxidative stress, which is imbalance of accumulation and production of reactive oxygen species. So excess ROS can cause damage to molecules like DNA, proteins, and lipid molecules. So the condition, the oxidative stress is also related to diabetes because there's excess of glucose oxidation. So I think the molecule that is used for antibiotic treatment should have antioxidant properties. So I selected fig fruit as a possible treatment for diabetes. The reason I chose this is because the tree was grown in many regions in the world and is used as food and medicine since 13th century BC. So it would be easily available and suitable for prophylactic treatment. And there are also literature that suggests that phytochemical present in figs has antibacterial and anti-diabetic properties. So to address the problem of diabetes and oxidative stress, the molecules from figs are evaluated. So the aim of this is to evaluate the antioxidant and of phytochemical present in figs, and then to use frontier orbital analysis for evaluating in silico antioxidant potential of phytochemical, and to calculate the drug-like characteristic and the probable toxicity. So I researched this topic by evaluating antioxidant, anti-diabetic, and ADMET properties. So for anti-diabetic properties, I docked the molecule with pancreatic amylase and salivary amylase and compare the result with the control, which is glibenclamide. And ADMET properties and drug likeness is evaluated by the web servers. And then frontier orbital energy calculation is calculated. So this is the table for result from frontier orbital calculation. So HOMO, LUMO, EPA, and ionization potential, electronegativity, EA is calculated. So ionization potential shows the amount of energy needs to remove that is needed to remove electron from the compound. So it implies the reverse relationship with antioxidant property. As the lower IP value, the easier the electron is lost from the molecule, which makes it better for free radical scavenging. Electron affinity is the amount of energy released when electrons are added. So high electron affinity can absorb more electron readily, suggests positive relation with the antioxidant properties. And then the gap in HOMO, LUMO which is the EPA, shows inverse relationship with the chemical reactivity. So beta carotene with the smallest HOMO, LUMO gap is the best antioxidant, while camphorol is with the highest HOMO-LUMO gap is the least antioxidant amongst the 10 molecules studied. So this is the drug likeness of the molecule from one of the web server used. So the molecule that violate the most drug-like rule is beta-carotene and lutein, even though beta-carotene was the best antioxidant. So violation of drug-like rule might suggest that they have poor oral absorption and less suitable for drug making. So I did not use them to dock with the amylase. This is the toxicity of the molecule. So the molecules, most of the molecule range between class 2 and 3 oral toxicity, which is considered less toxic. So, and then catechin is class 4, which is the least toxic of the molecule studied. So this is the docking result from AutoDockLiner. So the result is compared with the control, which is glibenclamide, and the result from most of the molecule is comparable to the control. So in conclusion, to evaluate anti-diabetic and antioxidant properties of the molecule present in FIG, frontier orbital energy calculation is used, and then ADMET properties and the drug likeness of the molecule is assessed. The drug likeness show that beta-carotene and lutein might not be suitable for drug making. So the rest of the molecule is docked with amylase to see the anti-diabetic properties. So the result is that most of the molecule is comparable to the control. So FIG might be suitable for treatment of diabetes and oxidative stress. So that's it. Thank you.
Thank you, Sivit. Thank you for the presentation. Diabetes indeed is a big challenge in India, and more studies are required. However, selection of this plant, FIG, when it comes to Indian context, India being, I believe it's going to lead very soon in diabetes and hypertension.
Yes.
With the health that is going on. Why FIG? Actually, FIG is expensive. And if you want to, how do you propose to scale up? Because when we talk of drugs, or especially the natural drugs, the main challenge with these natural drugs is like coming from the natural sources. How do you scale up in the big? I'm asking very end line question though. How do you propose that you can scale up this? A, B, then docking. Then when you did docking, I always have this issue with docking. When you're doing simulations, docking we can manipulate very easily. And the binding energy that you get from the docking is very, very small. That's a big challenge, that when you do the docking, you can see that it is going to bind, but when it comes to the natural environment, you're talking about amylase. When I put anything in my mouth where amylase is there, in saliva, then it's altogether a different milieu. It's a different environment, right? How do you explain that and how do you justify? Because whatever research we are doing, if it is not reaching somewhere, if it's not bringing some, end conclusions or information, knowledge to us who are listening to you, so how do you justify that? These two things.
Right.
Two questions.
I think that this paper is just for evaluating what is there. It might like for further researches. So like I acknowledge the fact that like docking might not be like not be the same in the natural environment. So
Yeah.
like further research is still needed on this.
Yes, yes. So I mean, like I'm a vet biologist. I do the wet lab experiments, and I
Yes.
rely, and I can see Monali just laughing because she's a wet lab experimentalist, and she can
Yes.
relate that when we rely on bioinformaticians' information, right?
Yes.
So if we do not have 100% confidence, we can't invest our money for doing the wet lab, even in vitro. So how do you convince me if you are not convinced yourself?
Sir, in addition, what he did is he just selected the phytochemicals, but he never
Yeah.
mentioned the targets also. So when
Yeah.
he's selecting the phytochemicals and not labeling the targets, we are unsure. It's like throwing a stone in water and testing
Yeah.
what will happen.
What will happen? No, I think they want to target amylase in general, right? If I'm not wrong, if
Sivat, can you tell me which target you are planning to do?
Amylase.
Amylase. So are you
Yeah.
sure none of the studies or the phytochemicals have been tested against amylase? Why amylase? You think amylase is causing diabetes or is a trigger for diabetes?
Yeah, I mean, like that's another thing. Exactly.
Because if you inhibit amylase, none of the sugars will be metabolized or taken up by the body itself. So you are basically restricting the ingestion or digestion of carbohydrates.
Okay, I think we can move on, right? Maybe he's not comfortable with that. So we can move on to the next speaker. Next speaker is Dr. Alka Devi, and let's move on.
Alka Devi, would you please start the presentation by sharing your screen? Yeah. Thank you.
Yeah, good evening. Am I audible?
Yes, you're audible.
Yeah, good evening, Ashwini sir.
Hi, how are you?
I'm
you may
good.
start.
How are you?
Good,
Yeah.
good. Start, please.
So myself, Dr. Alka, and I am working as a SRF at IRI, Indian Agriculture Research Institute. So I am here to represent my work on the species Dunaliella, which is a key powerhouse for the nutraceutical. So this is my abstract which I have submitted. I'm here mainly focused on the microalgae. Why? Because it is a powerhouse not for the nutraceutical but also for many other fields like biofuels, many pharmaceutical reagents, and many protein contents. So as we all know, microalgae one of the oldest microorganism on the earth. So I'm here mainly focused on the Dunaliella because a Dunaliella is a halotolerant. So it is a marine microalgae which can grow on a high salt condition, and it have the ability to produce high level of lipid, high level of beta carotenoid. So I'm talking further about the beta carotene. These are the main features of Dunaliella, which is why I'm working on it. So this is the cell structure of the Dunaliella salina. It is belong to the Chlorophyta phylum. Chlorophyta is a chlorophyll containing microorganism. That is why they are green in color. They are mainly Dunaliella is a unicellular photosynthetic motile biflagellated microalgae. So it is distinguished between other microalgae on the basis of the cell wall. They lack the cell wall. That is why it is very easy to work with them. The cell structure is avoid spherical periform depending upon their growth stage and the function they are doing. So here the cell is appeared yellowish because this yellow pigment is the carotenoid, which is known as the nutraceutical compound. So the best known species for Dunaliella are the Dunaliella salina, Tertiolecta, Primolecta, and Media, etc. So I'm here focusing on the nutraceutical. So I should have to talk about something about the nutraceutical. It is the term which is first coined by the Stephen DeFleece in 1991, and nutraceutical are the compound which considered as food or the food supplement which have health benefit or they use to cure the disease. So here in Dunaliella, they are, as I told you earlier, Dunaliella is a rich source for carotenoid, mainly the strain Dunaliella salina. In carotenoid, we are focused on the beta carotene. Beta carotene is the lipid oil soluble product. It is the provitamin A, and as in the previous presentation, beta carotene are the high antioxidant compound. The beta carotene are produced, synthesized from the trypenoid. Trypenoid are the organic compound which is formed from the 5 carbon chain, and the beta carotene are 40 carbon compounds. So at each compound there is a beta ring. That is why they are known as the beta carotene, or they are synthesized from the GGPP, which I can explain in my further slide. So they are the non-polar compounds, so it is very easy to separate them with the non-polar solvents such as hexane. And Dunaliella, they have the efficiency to produce 12% of the dry weight. So that is why they are the rich source for beta carotene. So this is the pathway for carotenoid biosynthesis. This pathway is known as MEP pathway, which is methyl erythritol 4-phosphate pathway. So carotenoid is synthesized from the GGDP, which is derived from the glucose 3-phosphate from the glycolysis, and it is further processed by the different type of enzymes into the lycopene. Now this lycopene is the deciding factor. Either the carotenoid is converted to the alpha or a beta. In Dunaliella, there is an abundance of LC by B gene. That is why all the lycopene is converted to beta carotene. Now further, the beta carotene is converted to different type of xanthines, which is also a type of carotenoid, and they all have different type of activities, and they are also very important in pharmaceutical. So these are the compounds, the carotenes, which are derived from the Dunaliella, and these are the activities. For example, beta carotene, it have the anti-cancerous, anti-allergic characteristic. Likewise, the other xanthines have their specialized activity. That is why Dunaliella is a rich source or a promising source for nutraceutical source. So while working with the microalgae, there is a challenge for the production system. So production system mainly based on these 4 important factors in which microalgal selection, the type of microalgae is depend what our objective is. So the usage area, if we are using the microalgae for food production, so we can select the microalgae which have high fatty acid, vitamin, carbohydrate content. Or if we are using microalgae to save the environment or to lesser down the pollution, so we choose the microalgae from the polluted areas. So likewise, we also count the abiotic and biotic factors at what light, what temperature, what nutrient content, and they can grow, and in biotic factor how frequently they got contaminated or they can adapt the environment. And the other factor for microalgal system is their growth. These 2 pictures depict showing their growth system, in which there are open ponds are used, the bigger for the commercial level, growth of microalga, which have different techniques, the steering ponds, the circular, the raceways, and likewise reactors. So their production system is mainly divided into two systems. One is the outdoor pools and one is the indoor photobioreactors. So they are the chlorophyll containing microorganism, and so they are photosynthetic. So they need light, they need carbon dioxide to synthesize the biomolecules. So outdoor pools, they are the cheapest and the simplest system, and they are the most frequent use system for commercial level, and the commercially grown streams in outdoor pools are spirulina, hematococcus, and dunaliella. And in case of indoor photobioreactors, they are the closed and compact systems which have higher efficiency, but they are at the same time they are very costly. So on a commercial level, maximum companies prefer the outdoor pools. And the next challenge with the microalga is the harvesting. So this first picture is showing how we work with the microalga. We cultivate the microalga either the open pond or the closed bioreactor system. Then we harvest the cells. During the harvesting, we contain two compounds. One is the biomass, which contain the cells, and one is the media, which is the supernatant mainly. So there is, with microalga, it is the benefit, there is nothing to waste. So from the media, these are the main compounds which is we can extract, like EPS, extracellular proteins and lipids, phytohormones, etc. And with the biomass, we extract carbohydrates, carotenoids, lipid, phycobiliproteins, and proteins, etc. And after extracting all these compounds, the leftover can use for biofertilizer as well. So the second diagram, it is the layout for Dunaliella salina when we grow the strain and we treat with the solvent system to extract the different compounds from the cell. So we during the solvent extraction, we do different type of techniques. During sponification, we get the proteins and glycerol, and further membrane processing, by disrupting the membrane of the cells, we get carotenoid, chlorophyll, glycerides, and further processing of the membrane, we get the free fatty acids, and likewise we get the proteins and other. Depending upon the solvent system, we get different type of compounds. So in conclusion, I would like to conclude my presentation that microalga is a photosynthetic organism. So we don't need to put much effort for them to grow, or or to scale up the things. We can scale up the process by using the cheaper media, not the analytical grade. And there is lots of scope with the microalga. We can explore the cells to any extent. And to talk about the Dunaliella salina, it is the green algae which have the higher number of beta carotenoid, which can be used for the nutraceutical, and further refining of the carotenoid, we can use them into the pharmaceutical field also. And because not only carotenoid, Dunaliella species are also very efficient to produce high level of lipid, so we can also use them for biofuel production. So this is all for my presentation. Thank you.
Thank you, Alka. Thank you for the presentation. So it was more of a theoretical presentation rather than experimental. So, so what are the experiments we are expecting from you in future?
Sir, right now I'm working on Dunaliella tertiolacta, actually not salina. So I am working on biofuel production from the tertiolacta. So we are working for extraction of lipids, and we are working how to enhance the lipid production in Dunaliella by not by molecular biology, because it is very a critical point in microalgae if we, genetically modify the strain. Maybe there are mix up the natural flora with the genetically get the adverse effect in the future. So we are applying the chemical stress to the microalgae.
So
Yes.
why have you not presented what you're working on rather than presenting nutraceuticals? We would have loved to hear
Sir,
about that.
This is the next portion, next experiment for my work. Actually, I don't have the
Because
results.
I don't have much experience with this alga, alga in general. But why, since you are reading on it, my query as a layman, I would just say, is why alga-based products are not successful in the market yet.
So this is not the case. We all know spirulina.
That's the only one. We just end up with spirulina.
No. Beta carotenoid we extract from these 4 strains which I am naming. Spirulina, Hematococcus, and Dunaliella. They are commercially used strains, and in of course in India, except the spirulina, we are not using the other strains also. So in US, there are these 3 strains are commercially used strains for a pharmaceutical.
Because I'm trying to understand the Indian perspective only, that when we are working and how we can modify this.
Sir, I think in India, we are not very interested in investing the thing rather than getting the result. We want free ka result than investing the money into
that's very diplomatic answer. I'm not getting into there. So, okay. Thank you. Thank
sir,
you.
may I ask a question to her? If you
Yes,
permit?
definitely.
Yeah.
Yes, sure.
Yeah, Dr. Alka, may I ask why did you use a halotolerant species?
Because they are the salt tolerant and there is the least chance of contamination in this particular microorganism. That is why. And they have the high lipid content. As I told you, I am working on bioenergy. So bioenergy, basically, I'm working on biodiesel. For that, I need a high lipid producing microorganism.
But here you have said Donaliella is a nutraceutical. Okay, so when we are talking about nutraceutical and you say spirulina is the available algae source of protein. So have you made a comparative analysis about Donaliella and spirulina as a source of protein or for lipid? If at all we are going for nutraceutical?
Yeah, on the basis of protein, spirulina have the high protein content, but on the basis of carotenoid, particularly beta carotenoid, then Donaliella is dominating on that.
Then
that
we
is
have microbes other than Donaliella which require less investment for growing. So what is the USP of Donaliella?
Donaliella, we don't have to go for a selective media, like for a media for spirulina is quite expensive than Donaliella. So
I'm talking about beta carotenoids. You said that Donaliella species have higher amount of beta carotenoids.
Yes, but
so we have other options also, bacteria also, which are producing carotenoids. So why an algae which requires more nutrients, more time frame for growing rather than any bacterial source?
So with the microalgae, the cell biomass is huge than the bacterial cell. Cell size is huge and the production is huge. So that is why microalgal system is a bit better than the bacterial.
Alka, you are a bioprocess student, okay?
Yes, sir.
You worked in bioprocesses, okay? So saying that bacteria cannot be used for biomass production of beta carotenoid is not something that I would buy, because it's E. coli is like used in a lot of places for mass production of so many products, right? And yeast is used. So saying that you can't use the prokaryotic system.
So the negative impact of the microalga is less than the bacterial system. So I'm just saying, if I'm working with the spirulina, for example, or the Donaliella, for example, they have the bioremediation properties. If I'm throwing them into the environment, there is not even a 1% chance of cross contamination or other.
There are a lot of
contamination.
bacteria also which are used in bioremediation. There are tons. And
Yes,
a lot
sir,
of
but
technologies are coming. So
I'm not
okay.
saying the bacterial
Yeah, yeah.
system is
So-
not that important than the microarray.
Okay.
I have
think
worked with the
that's
bacteria
endless.
outside.
That's like an endless discussion. We can take it outside this. Okay. Thank you,
Yes,
Alka.
sir.
Thank you very much for your
Thank you so
presentation.
much, sir.
Yeah.
Thank
yeah,
you, sir. Okay.
Thank you, Ashwini,
Uh,
sir. We had
Thank
a
you,
wide
thank
range
you,
of
thank
topics.
you, all of you. Yeah, thank you for giving this opportunity. It's always nice to hear, young people coming up with a lot of innovative work, and then which we also learn something which we don't normally go through. So thank you so much for the invite. Yeah.
Thank you so much for giving us your precious time. Thank you, sir. We'll end the session here. Thank you.
Yeah, thank you.
Yeah,
So we end here, right?
Yes, sir.
sir, would
So-
you,
yeah.
myself, Pankaj Sharma.
Yes. Yeah.
So actually, it is requested to kindly send the evaluation sheet to the.
I will.